Hello, my name is Emma. Welcome to this short pre-assessment video. We are part of the multidisciplinary team on the elective orthopaedic ward at Frimley Health. The aim of this video is to prepare you for what to expect as an inpatient. The video will also include a short talk from occupational therapy and physiotherapy teams. You are coming into hospital for a total hip replacement. This is usually required due to underlying osteoarthritis or congenital problems. A hip replacement involves replacing the worn-out parts of the hip joint using metal and plastic components. There are risks to this surgery, as your surgeon will have discussed. These risks include deep vein thrombosis, pulmonary embolism, infection, loosening of the prosthesis, and dislocation, which may require further procedures. If you have any concerns regarding these risks, please speak to your surgical team. As part of your operation, we run an enhanced recovery programme. The aim is to optimise patient care and assist you in recovering quicker. Enhanced recovery begins with nutrition drinks, which you will be given before you come into hospital. You will be instructed by the ward staff of when to take these. On the morning of your surgery, we advise that you take 2 paracetamol tablets. If you currently take any medication containing paracetamol, please discuss this with your nurse during your pre-assessment appointment. You will arrive on the ward on the day of your surgery either in the morning or afternoon. The nursing staff will admit you and you will meet your consultant or a member of their team who will discuss the operation and mark your operated leg. You will also meet your anaesthetist who will discuss the options and types of anaesthetic available. The surgery is normally done under spinal anaesthetic. This involves an injection into the lower back to numb the lower half of your body. You may be awake or have mild sedation during your operation. The spinal anaesthetic wears off quickly and allows you to recover and walk sooner after your operation. Your anaesthetist will explain more about the anaesthetic on the day of your surgery. When it's time for your operation, you will be taken to theatre on a trolley. You will pass through the anaesthetic room before going into the operation theatre and then on to recovery post-operatively. The length of surgery is approximately 1.5 hours long. When you are ready, you will return to the ward with a nurse. Your wound will be closed with clips or dissolvable stitches, and these will be removed or trimmed around 10 to 14 days at your GP surgery. Your wound will be covered with a waterproof dressing. It is important that you take regular pain relief and tell your nurse if you are in pain. You will also be discharged home on a course of pain relief. Time spent in hospital following surgery has reduced significantly over the last few years. Changes in surgical technique and support allows patients to go home the same day or within 24 hours of their surgery. There are many advantages to being in your own environment, including reducing the risk of complications and being in control of your own recovery. Therefore, please make sure you have someone to bring you into hospital, take you home, and support you for the first 24 hours. At your pre-assessment appointment, you will be advised on what support you may need on your discharge, so please make sure you have some plans in place. After discharge from hospital, you will be contacted by the arthroplasty nurse to see how you are managing at home. Here are some key points following your surgery. Your recovery can take between 6 and 12 months. To maximise your recovery, it is crucial to continue with your exercises and mobility practice. Please follow your physiotherapist's advice. You cannot drive for at least 6 weeks and should not fly for 12 weeks on a long-haul flight or 6 weeks short-haul. This is to minimise the risk of developing a deep vein thrombosis. If you have any questions regarding the information we have given you, please discuss this with your nurse at pre-assessment.
Hello, my name is Ryan. I will now explain the physiotherapy pathway after your total hip replacement. We will send you the exercises for your total hip replacement prior to the operation. To help maximise your fitness before your surgery and enhance your recovery after your surgery, we recommend you start your exercises as soon as possible. Work up to completing the exercises 2 to 3 times a day, every day before your surgery. It may be beneficial to practice the exercises on both legs, but mostly focus on the leg that is going to be operated on. If you're experiencing too much pain or discomfort with a particular exercise, stop doing that exercise or reduce the number of times that you perform it. We will see you in the morning of the operation to measure you for elbow crutches to the correct height. We would teach you how to walk with crutches correctly. There is lots of research to support early mobilisation following the surgery. Evidence shows early mobilisation reduces post-op complications and creates better outcomes following the surgery. We therefore like to get you up and moving on the same day of your operation. We will see you in the afternoon once the anaesthetic has worn off. We will start by teaching exercises to increase the range of movement and muscle control of your hip. You will need to continue with these exercises to reduce pain and stiffness in the hip. We will also show you how to get in and out of bed and how to walk with the elbow crutches. We will also practice going up and down the stairs if you have stairs or steps at home. Once you are mobilised with the crutches independently and safe on the stairs, you will be discharged from physiotherapy. If you are also medically fit and well, you will be discharged home the same day. If there are any concerns, you will stay overnight and go home the following morning. It is essential you continue these exercises at least 3 times a day. You can also continue to increase your walking distance with the crutches, including outdoor walking.
Hi, I'm Karen. I'm part of the occupational therapy team here at Frimley Health. I'm here to help you plan and prepare for your upcoming elective hip replacement surgery. There may be some restrictions following your surgery on how you carry out your daily routine. These are often called hip precautions and will prevent you from crossing your legs, twisting at the hip, and limit how far you can bend post-operatively. If you're placed under hip precautions, these are generally for 6 weeks. Following this, you can begin to return to normality. Your therapist will discuss these with you on the ward if they are applicable. Furniture. It's best to have a good firm chair with arms. This could be an armchair, dining chair, or even a comfortable garden chair. When you are sitting, you should have your hips higher than your knees. You'll find it easier to get into bed using your unoperated leg first and get out the same side. You may need to consider moving your bed to accommodate this. It's likely you'll need to sleep on your back for the first 6 weeks following your surgery. It might be useful to practice this beforehand. You may be struggling with getting on and off of the toilet already. This is something your occupational therapist will discuss with you prior to your surgery. If you feel you need advice regarding this beforehand, please consult your information pack. Personal care. There are several aids to help you with washing and dressing following your surgery, but these are not essential. A helping hand, a long-handled shoe horn, a long-handled sponge, and a sock aid. You can buy these on the internet or from some high street and mobility stores. If you've been unable to buy one before your surgery, we often have these items available to purchase on the ward. If you have access to a shower cubicle or a wet room, you can use these as soon as you feel comfortable. If not, we would recommend that you have a strip wash until you feel confident that you can lift your leg over the bath. In all cases, it's best to have a non-slip mat in place. You may need help with washing and dressing your lower limbs. This is where the long-handled aids are useful. It's a good idea to practice using these before you come into hospital. It's a good idea to sit down to dress and ensure that your clothes are within reach. After your surgery, you should wear loose fitting, comfortable clothes and supportive shoes. Ideally, these will not be lace-ups. Domestic tasks. You should prepare your home before coming into surgery. Remove any trip hazards such as rugs and mats to enable you to move around safely using your walking aid. Stock up your fridge and freezer and move any frequently used items such as plates or saucepans to hip level. This will help when preparing meals. You will need to arrange help with household tasks such as hoovering and laundry. You'll be advised that you're unable to drive for around 6 weeks after your surgery. Please consider how you might manage your food, shopping and appointments. This useful information is in your pre-assessment pack. It's a good idea to read this thoroughly. If you have any worries or concerns, please talk to your occupational therapist. Getting in and out of a car. Make sure that the car is parked on a level and away from the curb. Move the passenger seat as far back on his runners as it will go in order to maximise leg room. Recline the back of the seat. Walk up to the car and position yourself so that the backs of your legs are against the car door frame. Prepare to sit down by placing one hand on the dashboard and the other on the door frame. Sit as far back onto the seat of the car as possible, remembering to keep your operated leg straight out in front of you. Lean backwards onto the reclined seat and swing both legs into the car together. If you are struggling to get your legs in, then you can use a carrier bag on the seat or get your driver to assist you. Once in a comfortable position, adjust the back of your seat to a more upright position. However, when adjusting the back of your seat, it is important that your hip is not bent to an angle of more than 90 degrees, so keep your legs out straight. You should now be able to do your seatbelt up without difficulty. To get out of the car, reverse the procedure, not forgetting to recline the seat. Thank you for listening to our short pre-assessment video. We hope it helps.